There is a moment, and if you are over 60, there is a good chance you have had it, where you reach down to touch your own feet at night and they are cold, not chilly cold, and the room is not cold. Your hands are not cold, just your feet. Most people pull on a pair of socks, think nothing of it, and go to sleep. I want to talk to you today about why that moment matters more than most people realize, and why what happens in your feet at night can tell you something important about what is happening inside your blood vessels right now. Because cold feet after 60 are not just about temperature, and the cramps that wake you up, the ones that grip your calf at 2 o'clock in the morning and force you to stand, those are not just an inconvenience either. There is a connection between these things, a single underlying pattern, and by the time this video ends, you will be able to read your own body in a way that most people simply never learn to do. I am also going to show you one visual sign, something you can see on your own skin, that almost everyone explains away as aging, when in fact it is your body trying to tell you something specific about your blood vessels. We will get to that. But first, the feet. I am Dr. Nora Khalil. I have been practicing medicine for 12 years, and a significant part of my work over the past several years has been with patients over 60 who come to me with symptoms they have already written off as normal. The cold feet, the heavy legs at the end of the day, the cramps, the swelling around the ankles that was not there 5 years ago. These are not normal. They are signals, and this channel exists precisely to help you learn to read them before they become something harder to reverse. If that is why you are here, I am glad you found this. Consider subscribing. I release new content every week built around exactly this kind of conversation. Now let us talk about what is actually happening. Your feet are the farthest point from your heart. That sounds obvious, but what it means in practice, especially after 60, is that they are the first place to feel it when blood flow starts to slow. Think of it like a garden hose. When water pressure is strong, it reaches the end of the hose with full force. When pressure drops, or when the hose itself narrows or stiffens, the flow weakens before it ever reaches the nozzle. The middle sections still get water. The far end does not. Your arteries work the same way. As we age, arterial walls gradually lose some of their elasticity. They stiffen. In some cases, fatty deposits begin to accumulate on the inner walls, a process called atherosclerosis. The lumen, the interior channel through which blood flows, narrows, and the extremities, the feet and toes and lower legs, begin to receive less oxygen, less warmth, fewer nutrients than they need. This is why feet go cold even when the rest of the body is warm. The heart is working, the blood is moving, but it is not arriving at the destination with the same pressure or volume it once had. It is not a temperature problem. It is a delivery problem. Now here is something I want you to think about in connection with this. The cramps that wake people up at night, the sudden gripping pain in the calf, the kind that forces you out of bed, are not always dehydration. They are not always related to potassium. In some cases, they are happening because the muscles of the lower leg spent the entire day receiving marginally less blood flow than they needed. And at rest, when circulation slows further, the deficit becomes acute enough to produce a spasm. I am not saying every nighttime cramp is a vascular problem. I am saying that when they are frequent and when they happen in the same legs that feel heavy during the day and cold at night, the pattern is worth reading as a whole, not as 3 separate complaints, as one message. I want you to hold that framing because what I want to show you next is how that same pattern, the aching, cramping legs during effort, can be hiding in plain sight, misread by both patients and sometimes by physicians. I had a patient, I will call her Margaret, who had been telling her previous doctor for 2 years that her legs hurt when she walked. Not before, not after, during. She would get to the end of the second block, sometimes the third, and her calves would start to burn. She would stop, rest a minute, and then the pain would ease and she could walk again. Her previous doctor told her it was arthritis. She believed him. She adjusted. She walked less. What Margaret actually had was called claudication intermittent claudication. It is not arthritis. It is not a joint problem. It is a circulation problem. Here is what happens. When you are at rest, your muscles require a modest amount of oxygen. Your narrowed arteries can still deliver that much. So you feel fine sitting down, you feel fine standing still. But when you start walking, the demand goes up. The muscles are working. They need more oxygen, more blood flow, and the narrowed arteries cannot keep up. So the muscles, when deprived of what they need, begin to produce lactic acid, pain, cramping, burning. You stop. The demand falls. The blood catches up, the pain disappears, and the cycle repeats. This is not aging. This is not stiffness. This is your arterial system telling you that the channel is too narrow to meet the demand. Margaret had been walking less for 2 years because she thought moving was hurting her. In reality, the lack of movement was making the underlying condition worse. This is the part I am going to ask you to remember because this next distinction is the one that changes what you do about it. I want to tell you about 2 patients I have seen who were almost exactly the same age, both 68, both retired, both described the same experience: heavy legs, cramping at night, cold feet in the evening. The first one came in early before the symptoms became daily. She almost did not make the appointment. She told me in the consultation room that she had hesitated because she felt embarrassed to come in for cold feet, that she worried it would seem like a complaint rather than a medical concern. I'm glad she did not listen to that voice. We caught it at a stage where lifestyle changes, specific nutritional adjustments, structured walking intervals, and careful monitoring were enough to make a measurable difference within a few months. Her arterial flow improved, her cramps became less frequent, she was back to walking her neighborhood without stopping. The second one waited. She had been telling herself it was arthritis, it was her weight, it was the new shoes. There was always a more comfortable explanation than the one her body was actually offering her. By the time she came to see me, the circulation in her lower legs had deteriorated to the point where her skin was changing color around the ankle. And she had a wound there, a small one, that had not healed in several weeks. That is one of the later signs of significant peripheral vascular compromise, tissue that cannot heal because it is not receiving the blood flow it needs to repair itself. Same age, same starting symptoms, very different places. What separated them was not genetics. It was not luck. It was not even access to care. Both had doctors they could have called. It was knowing what they were looking at and believing it was worth taking seriously. And this brings me to the sign I mentioned at the beginning of this video, the one you can see on your own skin, the one most people never connect to circulation. Look at your lower legs, your ankles, the tops of your feet. There are 2 changes I want you to look for. The first is a shift in color. Skin that looks paler than it used to, almost blanched when your legs are elevated, but becomes darker, purplish, even slightly mottled when you let your legs hang down. This color change with position is not cosmetic. It is a vascular sign. It means the blood is not moving efficiently. It pools when gravity assists it and drains away when gravity reverses. The second change is texture. Skin on the lower legs that has become thinner, shinier, or that has lost some of its hair. Hairless patches on the lower legs and feet, particularly in men, are often a quiet indicator of reduced arterial flow to that area. Hair follicles are sensitive to oxygen. When the supply drops, the hair stops growing. And then there are varicose veins and spider veins, which many people treat as a cosmetic problem. They are not only cosmetic, they indicate that the walls of the veins have lost some of their structural integrity and that the valves inside those veins, which are supposed to push blood upward back toward the heart, are no longer closing properly. Blood is pooling, pressure is building. All of these signals on the surface of the skin are the body's way of externalizing what is happening internally in the vessels. Now, I want to tell you what you can actually do about it. And specifically, I want to talk about 4 nutrients that have a real documented role in vascular health and how to get them in a way that is practical and sustainable. The first is vitamin B3, also called niacin. Think of the inner walls of your blood vessels as the lining of that garden hose I mentioned earlier. Over time, with age and the cumulative effects of inflammation, that lining can become less smooth, less resilient. Niacin helps maintain the flexibility and structural resistance of those walls, which in practical terms means the channel stays open longer and the conditions for plaque formation are less favorable. But here's what I find most interesting about niacin from a circulatory standpoint. Its effect on cholesterol is not just about lowering numbers on a lab panel. It specifically helps reduce LDL, the form of cholesterol most associated with the accumulation of fatty deposits on arterial walls, while raising HDL, which plays a role in removing cholesterol from vessels. This is a meaningful distinction. Not all cholesterol management strategies do both. The most practical sources are foods most people already know: eggs, chicken breast, salmon, tuna, and almonds. These are not exotic or expensive. They are the kind of foods that, eaten consistently, begin to support the vascular system in quiet ways you may not immediately feel, but that show up over years. Adults generally need between 14 and 16 millijars of niacin per day, an amount that is entirely achievable through a varied diet. Supplements can provide higher doses, but they carry a specific risk worth knowing about. At higher supplemental doses, niacin can cause what is called a flush, a sudden, intense reddening and warmth across the skin, often accompanied by itching. It is temporary and not dangerous, but it is uncomfortable, and it is a signal that the dose exceeded what your system needed. If you are considering a supplement, that is a conversation to have with your physician rather than a decision to make independently. But here is what I want you to pay attention to now, because this next vitamin works at a different level, at the level of the vessel wall itself, and it is the one I find most patients have never thought about in the context of their veins. Vitamin C is understood by most people as an immune support nutrient, something you take when you feel a cold coming on. What fewer people know is that it is essential to the production of collagen, and collagen is a critical structural component of vein and artery walls. Without adequate vitamin C, those walls become more fragile over time, more prone to microdamage, more vulnerable to the kind of low-grade inflammation that quietly accelerates vascular aging. The integrity of the vessel wall, its ability to withstand the constant mechanical pressure of circulating blood, depends in part on how well that collagen scaffolding is being maintained. Think of collagen as the reinforcing material inside the walls of the hose. Without it, the hose weakens from the inside out, not in a dramatic, sudden way, but gradually in ways that only become visible once the structural failure is already underway. Good dietary sources include citrus fruits, kiwi, strawberries, guava, red bell pepper, broccoli, and spinach. These are foods that offer a meaningful amount of vitamin C without requiring supplementation in most cases. One thing worth knowing, vitamin C is sensitive to air and light. Once fruit is cut and left exposed, it begins to oxidize and lose potency. Fruit that has been sitting pre-cut in a refrigerator for 24 hours has already lost a significant portion of its vitamin C content. Fresh preparation, cut and consume, is meaningfully better than convenience packaging. On supplementation, most people do not need high-dose vitamin C supplements, and there are risks at the upper end. Doses above 2,000 milligrams per day can cause digestive discomfort, and particularly in those already predisposed, may increase the risk of kidney stones. Moderate supplementation, if recommended by a physician, is generally well tolerated, but as with most nutrients, food first. Now, the next vitamin carries an important nuance that I want to make sure you hear clearly. Especially if you are on a specific type of heart medication, vitamin K manages something critical in vascular health, the balance of coagulation. This is often misunderstood. People hear blood clotting and think of bleeding, of wounds that do not close, but the coagulation system is not a one-way switch. It regulates both directions. Vitamin K helps ensure the blood clots appropriately when it needs to. After injury when a vessel is breached, while also supporting the inhibitory mechanisms that prevent clotting from occurring spontaneously inside intact vessels, where it becomes a thrombus, a clot in a place it should not be. In the context of circulation after 60, that balance matters significantly. The risk of deep vein thrombosis, a blood clot forming in the deep veins of the leg, increases with age, with reduced mobility, and with vascular changes we have already discussed. Vitamin K's role in maintaining appropriate coagulation balance is not a minor detail. It also plays a lesser-known role in calcification. Vitamin K activates proteins that help prevent calcium from depositing in arterial walls. Arterial calcification, the hardening of vessels from calcium accumulation, is one of the mechanisms that accelerates arterial stiffening after 60. Adequate vitamin K intake supports the inhibition of this process. The best dietary sources are dark leafy greens, spinach, kale, broccoli, and kiwi. A practical way to incorporate several of these at once is a green juice made with celery, kale, kiwi, or apple, ginger, mint, and cinnamon, consumed with the pulp intact for maximum benefit. Now the important clinical note, and please listen carefully if you are taking a blood thinner. If you are on warfarin, the issue is not that you cannot eat these foods, it is consistency. A sudden large increase or decrease in your daily vitamin K intake can alter how your medication works, which directly affects your coagulation balance. The principle is this: keep your intake steady from day to day and discuss any significant dietary changes with your physician before making them. Your medication dose may have been calibrated around your current intake. Changing that intake without adjusting the dose shifts the equation. These foods are not dangerous. The inconsistency is what creates risk. The last vitamin I want to talk about is vitamin E, and this is the one I find patients are most surprised by. Let me give you an image. Imagine the inside of an old pipe that has been carrying water for decades. Over time, the walls begin to oxidize. The surface roughens. Material starts to accumulate. Flow slows. Pressure increases on the remaining channel. Your blood vessels age in a similar way. Free radicals, unstable molecules produced during normal metabolic processes, cause oxidative damage to the inner walls of veins and arteries. Over time, this damage accumulates. Walls stiffen. The smooth interior surface roughens. The conditions for plaque formation improve. Vitamin E is one of the body's primary defenses against this oxidative process. It acts as a shield intercepting free radicals before they reach the vessel wall, protecting the structural integrity of the lining. It also supports the production of nitric oxide, a molecule that signals the smooth muscle around blood vessels to relax, allowing vessels to dilate and blood flow to improve. The best dietary sources include almonds, sunflower seeds, pumpkin seeds, avocado, spinach, broccoli, extra virgin olive oil, and free-range egg yolks. A small handful of almonds, roughly 20 to 25, can supply a meaningful portion of your daily requirement. On supplementation, vitamin E is fat-soluble, which means it accumulates in the body rather than being excreted. High supplemental doses without medical supervision can increase bleeding risk. Dietary sources are both effective and inherently safe. Let me give you something specific to take from this. There are 5 patterns worth paying attention to in your own body. Things to notice, not diagnose, but to bring to a conversation with your physician if they are consistent. The first is tingling or numbness in the legs and feet. Not the brief pins and needles that come from crossing your legs for too long. That is normal, the kind that lingers, that happens without an obvious positional cause, that has become a regular part of your mornings or evenings. The second is feet that remain cold despite warm surroundings. If you are sitting in a warm room wearing socks and your feet are still cold to the touch an hour later, then that is worth noting, especially if it is something that has changed from a few years ago. The third is leg pain or cramping that specifically occurs during walking and eases consistently with rest. This pattern, pain on effort, relief at rest, is the signature of claudication. It is not random, it is predictable, and that predictability is exactly what makes it clinically significant. The fourth is changes in the appearance of your lower legs, ankles, or feet. Unusual pallor, a purplish or mottled tone, skin that has become thinner or shinier, or patches where hair no longer grows. These are surface signs of what may be happening in the vessels beneath. The fifth is varicose veins or spider veins that have become more prominent, more uncomfortable, or that have appeared recently in an area where they were not before. None of these, individually and in isolation, signals a crisis, but several of them together, persisting over weeks and worsening over time, that is a pattern that deserves professional evaluation. Not alarm, evaluation. What I want you to carry from this video is not anxiety. I want you to carry literacy, the ability to read what your body has been quietly showing you and to give it the attention it was always asking for. My father used to say, in the quiet way he said most things, that the body rarely shouts before it has been whispering for a long time. I have come to believe he was right. Cold feet at night, a cramp that stops you mid-walk, a vein that was not there a year ago, skin that has changed color on the lower leg. These are whispers, and what I hope you leave with today is not a list of symptoms to fear, but a set of signals to understand, because understanding comes first, and understanding is what gives you time to act. The 4 nutrients we covered, B3, C, K, and E, are not cures. They are part of the architecture of a vascular system that is being supported rather than neglected, and in most cases, getting them from whole foods is both practical and sufficient. If you found this useful, please consider subscribing to this channel. It is how you make sure you do miss what comes next. And if something in this video connected to something you have been experiencing, I would genuinely appreciate knowing that in the comments below. Leave a like if this is the kind of content you want to keep seeing. And take care of your circulation, because the distance between where you are now and where you want to be in your 70s and 80s is being built quietly today.